Right now it's time to get the Agnini brothers on stage. I don't see them. Okay, they're here. I'm very excited to welcome to the stage both Andrea and Alessandro Agnini from Italy, from beautiful Italy, from Modena. I had the chance to visit you. We had together a course series done with the digital workflow. They both are the founders of the digital dental implant revolution. This is also your topic for today. And I think this course you did already a few years with us, a full digital workflow, was really amazing for me, besides the visit of the Ferrari Museum. And yeah, it's really a pleasure to welcome you to the stage. I'm very happy to welcome you. Yes!
Great, man.
Yes. Good time.
So, thank you, Holger, for the kind introduction. Thank you to the TRI team for the invitation, for the kind invitation in this incredible venue. And we will talk about
digital dentistry today, and we will talk about what is digital dentistry all about, and this actually it's going to be our first question. So actually it's my first question to you, Alessandro. What is digital dentistry all about?
Okay, digital dentistry is all about creating new digital workflows, smart, simple and predictable. So we want to increase the quality, the efficiency, obviously, of our workflow in the office and increase the patient comfort, but also decrease the cost and decrease the time of the treatment. And remember that digital also increase the communication with the patient, with the lab, and communication with the team. So we want to engage the digital workflow to make our workflow super efficiency.
In fact, as Alessandro is mentioning, technology basically perfectly blends with what is the pandemic strategy. This is one slide that we show also to our team, in that we said that we should utilize digital more and more because we increase communication, we increase the standardization of our working flows, and also we increase biosafety. But most important, in our opinion, is that the technology is consistent with what TRI is doing in the last few years, because they are trying to be efficient, they are trying to be different from anybody else, and they will for sure get advantage of this first mover advantage that we are witnessing here today. And so, not only technology, but also material evaluation.
Yes, the
evolution, sorry.
The evolution of the material is incredible. The monolithic technology evolution enhanced the efficiency of the overall digital workflow. In fact, we have in the lab industrial material with a great mechanical and chemical characteristics. And we know if you use a monolithic material, especially in the back of the mouth, and use the digital workflow, we reduce a lot of the treatment time and the cost.
In fact, if you look at this slide in where are listed all the traditional workflow steps, we were at 15 steps. And if we combine technologies and materials, so full digital workflow with monolithic materials, we can reduce these 15 steps down to 5.
It's incredible, eh?
And this is a great time efficiency, absolutely. And also the less passage we have, the more accurate we are. And this is what we call the old digital dentistry, you know, already with the old approach. Until today, we were able to scan, to plan and to restore and to close cases such as this in one single appointment, combining technologies, monolithic materials, and of course, the dental team and the dental lab know-how.
So we have the CAD/CAM technologies inside, we have the acquired data, then the elaboration data in the CAD/CAM lab technician, and then elaborate the production phase.
And so basically we can summarize these digital implant workflow key points down to 7 steps, starting from, as Alessandro was mentioning right now, the data acquisition done with the intraoral scanner and the scan body, and then we pass to the lab in where we are digitally elaborating this data, and finally we are producing the data. These are the 7 steps that till today we knew that we had to face in order to be successful in digital implant dentistry.
The old digital workflow, Andrea.
Exactly. Starting with the scanning plan. You see this is a central incisors. Okay, we need to know what is the scanning protocol, how to place the scan body, which are the important scan that we need to do, the bite registration, the scan body scan, but
and
also...
it's very important, the scan of the provisional restoration chest side, because we want to send the right information to the lab of the measurement profile of our provisional restoration, and the lab technician can match the provisional chest side in the scan of the provisional in the mouth.
And of course, knowing what is a scan body and knowing the characteristic of the scan body is important while you are scanning. So us as clinician, we should have the know-how of what is the scan body. And this is the old scan body from 3, which had the scan region, a body, and a base. And we knew that the scan region was the key element to detect during the scan.
Yes, because it's very important to detect the 3D position of the neck or the head of the implant. This is very important during the scan situation. So the scan region is very important. It's very important also the precise connection, obviously, of the scan body on the implant.
At this point, we send the file to the lab, and then you see here the new scan body, the 3D touch, and we have the best fit done by Pier Francesco Goffarelli in this case, which is choosing 3 points to be placed also in the scan body library, which is this one, exactly in order to create the perfect best fit.
And also you can see the narrow scan body produced by 3 is very important, narrow, because in the narrow space we want to narrow scan body, because we want to detect very well the geometry of the scan body and send the right information to the lab.
Then, of course, why the scan body is important? Because it's determining which titanium base to use, and also if we need an implant analog, the scan body choice determines also the analog that we need to use. But T-bases had problems. We know that. We all face this.
We have a multitude of the T-base in the market. Copycat also T-base, Andrea.
Yes, and
different height, different surface, different color, and so different problem.
And we wanted to face this kind of problem. And 3 implant was already updated in the digital field, because despite there were problems on T-bases, they created extremely nice titanium bases that we were able to use with 4 cutting options, for example, with the anodized pink for better aesthetics, with a rough turn and surface for better retention. So 3 implant is continuously developing consistently with digital dentistry.
So 3 has created a smart T-base in the old workflow, in the old digital workflow. So
but
different height, different
is always updating. So what is new today, tomorrow is going to be old. And so that's why we should keep going, and we should updating and moving forward on this. Because moving forward on this workflow, we had also to 3D print a master model.
Yes, if you want to create a model, obviously you must have the analog. And the analog derives from the scan body. So the scan body, we have the titanium base and the analog for the model. If you manage an aesthetic area, obviously you must have a model, because the technician must
layer
the crown with the feldspathic ceramic, and check the contact point of the crown.
And the very last step of this all digital workflow was the T-based cementation. And also the T-based choice was tough, especially in the static area, because we needed versatile tie bases with different cuff heights in order to create a perfect emergence profile. And so that was another important aspect that we needed to double check before in our digital workflow. And if all these 7 steps that we have explained to you right now were done properly, this could have been the final result. But what is the next step? The next step is today, because we have discussed about the T-basis problems that we had. Despite the fact that we created a nice T-basis, we had anyhow higher percentage of the cementation, especially on PMMA. We needed the different cuff heights and emergence profile, as I mentioned, especially in the aesthetic zone. And there were possible misfits, anyhow, especially in the posterior area when the lab technician was cementing with no model the crowns with the T-basis. And so that is why the matrix implant workflow is extremely important, because we can bring down that 7 moments down to 4. Sorry.
Yes, we cut 3 steps. So we want to make the workflow more efficient.
And Sandro has brilliantly explained you this morning, 70% of the potential inaccuracies are reduced by doing this. And this is a lot, especially if you look at the big picture.
Yes, because it's logical, because you reduce the interface. You cut the interface of the cementation of the monolithic on titanium base.
So let's review now what has been our experience with the matrix. And this is the very first case.
So we started with 2 implants in the back region, do 2 bone level matrix implant, because my experience is on bone level, but I saw immediately the tissue level matrix implant, and so after this first case, I used this kind of implant.
And here you see the digital workflow. You see that we have the 3D touch in position. You see the double check, the X-ray double check, the intraoral scanning, the CAD design, the CAD elaboration project, till the production of a PMMA.
Yes, you can see the production of the PMMA, the production of the accuracy of the connection in PMMA. But in PMMA is so easy, probably is easier. Is easier.
And so we move forward. That's our second case. Once again, a bone level in a different site, anyhow.
Yes, a different site is a first bicuspid in patient with a high biomechanical risk profile, but low periodontitis risk profile. In the first bicuspid position, I put the bone level implant. I try to increase the volume in the vestibular side, try to skip respect the position of the implant, respect the buccal plate, and manage the provisional restoration utilizing the second bicuspid. So no immediate loading in this case.
The digital workflow is always the same. So the 4 steps: intraoral scanning, scan body scan, and then data elaboration at the lab. And this is the production that was brilliantly explained. I mean, we went through a lot of trials and a lot of efforts together with Sandro in trying to create this workflow as efficiency and productive as possible. And here you see the crowns, in this case, polished and ready to be inserted in the patient's mouth. And here you have the final situation before the final positioning. You see that the soft tissue has been maintained despite the loss of the tooth, and everything looked nice at the end. And moving forward with our experience, this is the last case that we want to show.
Yes, we have here a patient, a female patient, 82 years old, with with the periodontitis, in this case a stage 3 periodontitis, so it's very important to treat the periodontitis before place the implant, or together or in combination to the implant. And you see in the picture, I cut the distal root of the first molar and treat with the osteoresective surgery the perio problem and put the implant in the first bicuspid.
This case is a tissue level implant, and this case is nice because on one side it was placed a tissue level implant, and here you see a few snapshots of the procedure of the tissue level matrix implant, which is going inside the fresh extraction sockets. And on the other side, the same procedure, but with a bone level implant.
Yes, in the other side, we remove the second molar and remove the mesial root of the first molar, and then I put the implant in the middle and try to manage the infrabony defect around the implant and manage also the periosurgery, try to have an healing
Of first intention.
first primary intention over the implant.
So here are a few snapshots of the bone level 3 implant going in. And at this point, this is the follow-up at 4 months. We're going to follow through the tissue level implants because
yes, we recreate a positive architecture of the soft tissue around the teeth, around the abutment teeth, and also we maintain enough volume around the implant.
Here we have the scan plan. So you see the provisional restoration scan, the scan body scan, the lower abutment scan, and the bite registration scan. So first step of the digital workflow is completed, and then we send everything to the lab. And at the lab, you see the CAD design, once again done by Pierfrancesco Golfarelli, which is going to work on the emergence profile, is going to work on the thickness, and you see that the great benefits that digital brought to dentistry, the control of the major variables that we do have when we are facing these kind of cases. And so this is important because we are standardizing the level. Digital dentistry really standardized the level. And this is what technology is all about. We want to standardize the level of everyone. So we bring the quality of our restoration, the average quality of our restoration to the height.
Yes, here is a massive intercuspation case, so simple case, and treated the back of the mouth, so 3 crown on the upper jaw and 2 crown in the lower jaw, so no model need workflow.
Yeah. But remember that technology is always a tool, and you need to have also the traditional background, the traditional fundamental of dentistry, which are guiding you while you're working. And here you see that the lab technician is shaping properly, especially the fake root profile of this specific restoration. So technology is a great tool, but it's just a tool. So traditional fundamentals of dentistry are here to stay, and they will help you all the time in increasing your outcome successful.
Yes, and it's very important to manage the emergence profile, especially at the level of the teeth abutment, not only of the implant, because we have a vertical finishing line, so we want to maintain the volume and the profile of the provisional restoration in the mouth.
Here we have the CAM production. You see the final touches done by Pierfrancesco in this case. And here we have the final case. On one side, completed in the upper and lower, because also in the lower there were 2 teeth abutment that were done.
So the periodontitis has been treated, and we put in correct position the implant, the tissue level matrix implant, and then we finalize the case.
And so, what can we say for take-home message? I think that, Sandro, you explained so well this morning all the characteristics that we place here just in order as a reminder of what and how great has been the work that we have done in the last 4 years, and our take-home message can only be one right now, that the future is now. So we would like really to thank you for your attention once again. For the invitation, and we are open to questions. Also, you can send us questions, since there are many people watching online. You can send us questions through our social media as well. Thank you very much.
Thank you very much.
Thank you so much.
Thank you.
Andrea and Alessandro. We have received several questions from Dr. Passerini from Switzerland. He has attended one of your courses. I'm not sure if you remember him. Are you going to offer courses for the full digital workflow on Matrix in Italy?
Of course.
Yes, we haven't planned yet, but we should set a date.
You're more than welcome.
Let's do that.
Because we go to the Ferrari factory. First thing, we go to the Ferrari, so you're happy already. So you're already happy. Then whatever we show is fine.
And Pavarotti Museum.
And then we have a nice dinner at the Pavarotti Mansion. That's true.
And also in Bottura restaurant.
Yeah, now we are exaggerating.
Okay, I'll be there. I personally found the case very interesting, where you put like this bridge on 2 prepped teeth and 1 matrix implant. Actually, I don't know why, but I don't see this kind of cases very often. So I guess one reason is that you want to save the preservable teeth. That is that totally makes sense. Do you apply this treatment often, and do you see benefits from using Matrix in this kind of protocol to have like a bridge on prep teeth and also on implants?
Yes, when I consider that the teeth must be saved, I save the teeth and treat the perio problem. And in this case, we have 2 teeth treated and 1 edentulous site. And so I manage the provisional restoration on teeth and not loading the implant. This is the first objective in the treatment plan.
Obviously, it's a matter of diagnosis. You know, as Professor Jung was brilliantly explained later before, you do diagnosis first, you determine what is the risk profile of the patient, and then you tailor-made the treatment. So it's a customized treatment according to who you have in front.
I really like that case.
Yes, in the literature is well described, this kind of treatment all over the world.
Some more questions about the digital workflow. Do I need an intraoral scanner, and if yes, which one is compatible for the Matrix workflow? Maybe I can also reply to this, but
of course, you need an intraoral scanner, because this is really the moment in where you can differentiate and differentiate from other people, because only 15% worldwide owns an intraoral scanner, and you can use any kind of intraoral scanner. Just one suggestion: try to get the most versatile one, so the one that you can do many different things with the same instrument.
Yeah. As a comment from my side, you know, there is also classical impression post, so the doctor shouldn't be afraid to use Matrix with a conventional impression like we have seen. But I've heard from so many users who haven't had the intraoral scanner that this was the reason for them to start the digitalization. So we also feel, you know, that with this concept, a lot of clinicians will be motivated to take several further steps for digitalization. And of course, I totally agree, it's more fun if you do the scanning and not the conventional impression with Matrix. But it's possible.
Yes, and try to use the scanner not only in the prosthetic workflow, but also in the other workflow, orthodontic, in hygiene department. So we want to increase the visual communication with the patient. The communication is incredible through this kind of instruments. So we increase the perceived value.
Perfect. Thank you so much for coming here from Italy. It was very great to have you here in Zurich. Thank you.